video, I spoke about certain part very briefly about the management of endometriosis, which included hormonal treatments, surgery, and I also told you something about natural methods. Today, I will be expanding a little bit more on how you can control your endometriotic symptoms naturally. Having said this, only by natural methods you will be able to control all your symptoms. No, you will require surgery, you may require hormonal treatments, but this is a tool which helps you to get a better outcome of your surgery as well as your hormonal treatments. It helps you to maintain your body, maintain your mind. It gives you that aspect, it gives you that confidence that you can control your body and that endometriosis is not controlling you. First, in this natural methods, first and foremost, I would like to talk is about physical activity. How much are you moving? Endometriosis is seen varied age groups. I mean, you can see it even in adolescents, school going children, you can see it in between the ages of 20 to 40 and even beyond that. So depending on your age group, your activity changes. When you are a school going child, जब आप स्कूल में पढ़ते हो, you have physical education class, but beyond that physical education classes, are you doing something? आपको स्कूल जाने की इच्छा करती है कि नहीं? आप डेली फिजिकल एक्टिविटी करने की इच्छा करती है कि नहीं? स्कूल तो आप जा रहे हैं, घर से भी उठ रहे हैं, बस में जा रहे हो, बस से क्लासरूम में जा रहे हो. इन क्लासरूम कितना मूवमेंट है? बिकॉज बाय एंड लार्ज क्लासरूम इज अ सिटिंग डेस्क job as how I am sitting right now in the same way. So when I say physical activity, it means active movement. Active movement meaning now all your iPhones and your all these smartphones have applications wherein you can track your movement. You can track how much have you walked today, how much energy loss have you done today, what else can you do. So when I say physical activity, it means that how much are you walking every day, how much is your body moving every single day. Just simply plain walking. It doesn't always have to be very brisk wherein you want to lose weight. No, I'm talking about just plain walking. At least you should have 6,000 to 8,000 steps every single day. That itself gives you the energy to do a lot of things. It increases the good hormones in your head, which makes you feel a lot better. Just the simple mobility helps your hip joints, helps your pelvic region to not get stiff. So everyday walking. When I say everyday walking, it means 7 days a week. It does not mean that you get a Sunday and on a Sunday you are sleeping up till 11 a.m. No. At least try walking 40 to 50 minutes every day. This has various good aspects. I don't have to tell you more on it, but it is really important. Even on the days when you cannot muster that strength, when you feel that no, I cannot move, just the sheer movement is giving you pain somewhere on your shoulder, somewhere on the upper abdomen, lower abdomen, still I am asking you, please walk. Just a little bit of walking, slowly by slowly, maybe 5 minutes per day, maybe 10 minutes per day. Even in your bad days, walk at least for 5 to 10 minutes. This will definitely go a long way. You will realize that you are much more better in control of your symptoms just by simply walking. Along with this, we also give a lot of exercises specific to your pelvic region that is very individualized depending on what complaint the patient has, whether you have a bowel complaint or whether you have a bladder complaint or whether you have sexual complaints. Your pelvic floor therapy changes, but by and large, walking and exercise helps in endometriosis. It goes a very long way. So to be active is very important. Second thing that I would like to talk to you about is diet. Everybody says you have to follow a healthy diet. What an unhealthy diet? Anti-inflammatory diet. If you Google what is anti-inflammatory diet, you will get a lot of good data on it. And basically endometriosis is a chronic problem. It is an inflammatory problem, meaning there are certain cells in your body, it is there in the abnormal position, so your body is reacting against it. The reaction which the body gives causes all the kind of effects. So it will affect the tissues around it, it will affect the nerves around it, it will affect the vessels around it. It makes your body stiff. So when we say an anti-inflammatory diet, it is a healthy diet which helps you modulate your immune system. Having said that, red meat is very bad in endometriosis. By and large, you should avoid red meat, preferably to have a vegetarian diet, preferably to have a vegan diet. But again, in diet, it is very individualized. It depends on the person, from what background she is coming from, how much she can afford, what food products are available in her background. Depending on all of that, proper diet plan and a diet chart, we help her modulate what is available to her, what she has been doing for so long. It does not come just in a minute, it will not come in a day that I tell you do this and you will be able to follow it. It is a very, very long term process. Changing a diet may take even years altogether. But by and large, avoid red meat, avoid alcohol, avoid caffeine, avoid processed food, packaged food because it has a lot of preservatives, etc. Even the stuff that in the market they tell you no preservatives, please avoid. Eat healthy, eat fresh, eat a lot of crucifers, eat a lot of green leafy vegetables. Try to reduce the carbohydrate intake and the fat intake into your body. Avoiding dairy products also helps in endometriosis. Very small things. If you are going to office, if you are going to school and you are not eating at home, try not eating out of plastic containers, try eating out of glass containers. Why? Because plastic itself has certain things which changes the chemical balances in your body. So these are really, really small minor things which will help you in the future. Also, your cooking oil, use fresh oil, don't use those heavy oils. They say olive oil and flaxseed oil is good in endometriosis. It works very, very well. You see the changes in your body. Exactly on the diet plan, if you have any queries, if you have any doubts, you can very well come to my clinic. We can get you checked up for endometriosis and help you on those grounds. Now we talk about painful intercourse. This is one very major problem which I see in my clinics in very day-to-day life. Intercourse should be a very pleasurable and a very non-thinkable activity. But when a woman has painful intercourse, it becomes a problem for the couple and it becomes a problem even for them to have a child and everything. How can you improve your sexual life? There are multiple ways, there are multiple lubricants you can use, there are multiple oils that can be used. Also, there are multiple positions depending upon, it's very, very specific to the couple. We take very deep, detailed history. So talk to your doctor, talk to your gynecologist about all of this, and please get detailed way. You can have counseling sessions for these kind of things because these are really small things which does not require any major surgery to be done, or it should not be in such a way that it hampers your mental health and as well as your family health. Also, during the sexual intercourse, we teach certain kind of exercises which during the intercourse also, if you're having the pain, you can control that pain and you and your partner can feel much better. It is extremely, extremely important for you to have certain kind of mindfulness, some kind of meditation. It is not just out there in the books or because India is a country of land of yoga and this and that and that's why we are asking you to do it. No, it is very well documented. When you do meditation, when you do mindfulness, you are focusing your mind at a particular place. So you are actually trying to change the pain pathway in the body. You are trying to desensitize your body to the pain, which also the pain which goes from your pelvic region to your brain and gives you the sensation, okay, this particular thing is called pain, by and large carried by the sympathetic nervous system of your body. And meditation, yoga, these are the things which actually help you modulate this sympathetic nervous system of your body. It is documented. It is extremely good. Everybody should practice some form of mindfulness, whatever is available to you and whatever you feel comfortable in. It will go a very, very long way in helping you treat your endometriosis. Whatever these natural practices are, they are not the only practice. They supplement your hormonal and your medical line of management. These practices also take a while before you get used to it, a while before you see results. Usually it takes about 6 weeks to 3 months before you can actually start feeling better. But once you start feeling better, it is like a circuit. You feel better, so you want to do it more. So it is just the first step is difficult. Take the first step. You will get through your endometriosis in a much better way. Thank you.